Today, we're going to talk about something that can be as confusing as it is painful: frozen shoulder. If you've ever dealt with this, you know exactly how frustrating it can get. So let's break down what's really happening inside that joint of yours.
It often starts with just a simple, everyday movement. You reach back to grab your seatbelt, or you go to wash your hair, and bam, a sharp pain and a hard stop. It feels like your arm has just hit a wall. It's a very specific kind of stiffness that seems to come out of literally nowhere.
And what's so weird about it is that for a lot of people, there's no obvious injury. You didn't fall, you didn't pull anything. The pain just starts. And it often gets much, much worse at night, making it almost impossible to get comfortable and sleep. This mysterious start is one of the classic signs we're dealing with a frozen shoulder.
The official medical term is adhesive capsulitis, and here's a really great way to picture what's going on. Imagine the lining of your shoulder joint is usually super thin and flexible, kind of like silk. Well, with a frozen shoulder, that silky tissue mysteriously thickens up and tightens down, becoming stiff and tough like a piece of rawhide. That's what's physically blocking your arm from moving.
So who's most likely to get this? Well, it usually hits people between the ages of 40 and 65, and for whatever reason, it's more common in women. Certain health conditions like diabetes or hypothyroidism can also up your risk. But honestly, for so many people, it just happens spontaneously with no clear trigger at all. Okay, so now we have an idea of what's happening in there. But how does a doctor actually figure out if that's what you have? Getting the right diagnosis is absolutely crucial because, believe me, not all shoulder stiffness is the same thing.
A huge part of the diagnosis is the physical exam. First, your doctor will check your active range of motion. That's how far you can move your arm all by yourself. Then they'll test your passive range of motion, where they gently move your arm for you. Now here's the key. With a true frozen shoulder, both are seriously limited. That's the telltale sign that the stiff, rawhide capsule is the one physically blocking the joint.
You'll probably get an X-ray too. But here's the interesting part. You can't actually see a frozen shoulder on a standard X-ray. The real reason they do it is to rule other things out, like arthritis. So a normal-looking X-ray, plus that limited range of motion, well, that's actually a key piece of the diagnostic puzzle. And this quote just nails it, right? Lots of things can make your shoulder stiff, but a true frozen shoulder has this unique pattern. That's why getting a proper diagnosis is so important. It makes sure you get on the right treatment path from day one. So you've got the diagnosis. What does the road ahead look like? Well, the good news is that a frozen shoulder follows a pretty predictable three-stage journey from that initial awful pain all the way to recovery. Let's walk through this timeline together. It all starts with the freezing stage. This is where the pain is really the main event, and the stiffness just gets worse and worse. Then you hit the frozen stage. Here, the sharp pain might actually ease up a bit, but the stiffness is at its absolute peak. Finally, you enter the thawing stage. This is the long haul, where that stiffness gradually lets go and your motion slowly starts to come back over many months.
All right, so if you're on this journey, what can you actually do about it? Let's take a look at the toolkit of options that can help you manage the symptoms while your body does its healing thing. But first, before we dive into any of the specific treatments, you have to understand this one crucial point. The single most important factor in recovery is time. That's it. For most people, the body is going to heal this thing on its own, but it's a marathon, not a sprint. We're talking 12 to 18 months, typically.
Okay, let's open up that toolkit. Physical therapy is all about managing the pain and learning the right kind of stretches. It's not a quick fix, but it's a huge part of the process. Then you've got over-the-counter meds like anti-inflammatories, which can help take the edge off. And cortisone injections can be a real game changer because they put that anti-inflammatory medicine right inside that tight joint capsule, which can bring some serious relief. But what happens when the stiffness is just brutal, and it's been months and months, and it just won't let up? Well, for that small group of people, there are more advanced options to think about. Now, these are definitely reserved for cases that just haven't gotten better after a really long time. One option is called manipulation under anesthesia, where a doctor carefully stretches and breaks up that scar tissue while you're asleep. Another is arthroscopic surgery, where a surgeon actually goes in with a tiny camera to cut and release that tight capsule. But it's so important to remember these are rarely the first step.
So, after going through all that, what does the long-term outlook look like? Let's talk about what you can expect once you finally reach the end of that thawing stage. And this right here is the most encouraging part of this whole story. The long-term outlook for a frozen shoulder is excellent. I mean, the vast majority of people make a full or at least a nearly full recovery.
Let me put a number on that for you. Fewer than 5% of people are left with any significant long-term issues. So while the journey is really tough, the destination is almost always a return to normal.
A big question people always have is, can this happen again? Well, this is pretty fascinating. It almost never ever comes back in the same shoulder. But there's about a 20% chance that people might eventually get it in their other shoulder, especially if they have some of those risk factors we talked about, like diabetes.
I want to leave you with this quote, because it's just such an honest and empathetic message. It says, "Don't despair. It's a very difficult time for sure. It's likely going to pass. You just have to hang in there." And that really says it all. This is a tough, painful, and super frustrating condition, but it is very, very likely going to pass. You just got to hang in there.
So, after all the physical therapy, the injections, and the exercises, what is the single most powerful treatment? You know, it might just be patience. Understanding the natural journey of this condition, managing your symptoms, and just giving your body the time it needs to heal. That's the ultimate key to getting through the freeze.